Hi everyone, welcome to an Armstrong program for my dog and me, and this is Dr. Don Consla from Conneaut Lake Vet. And we did a little bit different today because instead of talking about dogs, which we always do, today we're going to talk about cats. And people that have cats, and such as myself, I have barn cats, but a lot of people actually have house cats, and you can ask them any question. I think you're going to run this as just a question and answer type deal, right? Mm-hmm. Okay, tell me a little bit about yourself.
So I'm from the Meadville area. I went to Allegheny College, and then I went out to California for veterinary school at Western University. Okay. And then recently came back, and like she said, I work at Conneaut Lake Vet Hospital, which is just right down the road. And
you also do exotic animals, don't you?
I do exotics as well, yeah. So
like
birds, lizards, small mammals like rabbits, ferrets, chinchillas, guinea pigs.
Is there anything you don't do?
Large animal.
Oh, you don't do large,
yeah.
Just mostly small. Okay, well, glad he does all those other things that nobody else wants to touch. Okay, here we go. Thank you.
All right, so we'll just keep it pretty casual. If you have questions, just feel free to interrupt me, and we can just talk about stuff as we go. Here's kind of a general outline for stuff I'll be talking about. We'll start off with vaccinations, why we do them, what are the benefits, what are the risks, what precautions do we take. The largest portion will be common feline diseases. We'll kind of just go through what things you can look for at home, kind of some background about these diseases, what tests your veterinarian might recommend if your cats are showing some of the symptoms for these diseases, and just some of the general treatments that are done, just so you can have an idea, going into the vet's office, what might happen. A brief thing on over-the-counter drugs. The litter box, both just general litter box maintenance care, and also when things start to go awry in the litter box. Grooming, again, just normal things you can do at home, and then when grooming habits start to change as well. Decline, a little controversy coming into the presentation. Stress-free handling, that's a big thing. People always come into the office like scratched up, and the cat's angry that I got shoved in the carrier, so I'll try and give you some tips to help with that. And then another kind of stress-related thing is pilling or giving medications at home. So let's start off with vaccinations. So in the veterinary world, we split up vaccines into two categories, and that is core and non-core. The core vaccines are the immunizations that we feel that all cats should have, regardless of what their lifestyle is. If they're indoor, outdoor, the only cat in the household, one of many cats in the household, whatever it may be, traveling, you name it, all cats should have those vaccines. Non-core vaccines are what we could call more lifestyle vaccines. And when we talk about those specific ones, I think you'll understand why. So starting with the core vaccines, the first one is rabies. Now in the state of Pennsylvania, it is not required by law for a cat to have a rabies vaccination. It is required for dogs, you might be familiar with that. But I can't stress enough how important it is to have your cat vaccinated for rabies. Rabies is a zoonotic disease, meaning that it can go from the animal to the person, and there's no cure for it. In the United States, we've, really gotten a great control on rabies simply because of vaccinating household pets and doing, outdoor vaccines like for raccoons and skunks and things like that. It's a fatal disease, whether it's an animal or a person that has it. The veterinarian's first role in our oath that we take is to protect the public. And so that is one of the biggest things that we can do on our part, and you guys can do to keep yourselves, your animals, and your family safe, is to vaccinate for that disease. That vaccine, the first dose is good for 1 year, and then every time it gets boosted after that, it's good for 3 years. The next core vaccine is FVRCP, which stands for the following diseases: feline viral rhinotracheitis, calicivirus, and panleukopenia virus. You may have heard this referred to as like a feline distemper vaccine, like the upper respiratory combo. Those are all kind of synonyms used for it. All these diseases we see pretty commonly in like stray cats, unvaccinated kittens. They all tend to cause like upper respiratory problems. The rhinotracheitis is caused by a herpes virus. and it just kind of stays in the system. So cats with that tend to just have chronic upper respiratory issues lifelong. So they'll have a flare-up, get a runny nose, be coughing, sneezing. We, give some supportive care, get them through it, and then 6 months later they get stressed because the Christmas tree comes out and they flare up again, and it just kind of goes on in that fashion. So the disease itself isn't really fatal, but it's costly, and it's a lifelong problem that the cat kind of has to deal with and the owner has to deal with. Calicivirus is another upper respiratory virus. It tends to cause some lesions in the mouth as well. And again, it's kind of a chronic infection, flares up under stress type of thing. And then panleukopenia is actually a parvovirus. You may be familiar with parvo in dogs. I think that's much more well known. But it's the same type of virus in cats. And it tends to basically just wipe out their immune system. So they come in with very low white blood cell counts and get infection secondary to that. Yeah?
I thought that they told me when I got her vaccinations that that they were going to give her 4 shots and ones to cover all 4 viruses that cats get. Are there 3 or 4?
These are like the main 3. They could have had different...
I thought there was a 4th one. Maybe they put it with something else. I don't know.
It could have been combined with another one, and then oftentimes we'll see, even though there's like these 3 viruses, there's like different types of them. So sometimes they'll have, like a type A and type B, and then plus the other 2 in there. So that could have been what that was about. So those are the core vaccines, basically rabies and those upper respiratory diseases that we see pretty commonly. Non-core vaccines, again, these are the lifestyle ones, so depending on what your cat is doing. And these are basically recommended for outdoor cats or indoor-outdoor cats. Feline leukemia, similar to leukemia in people, it wipes out the immune system, very low white blood cell counts, and they get a lot of secondary infections from that. There's not really any cure for it, so once they have it, they have it. And I'll mention briefly, whenever we get a new kitten in or a new cat, regardless of where it came from, we can always test for these 2 diseases, feline leukemia and FIV, to know if the cat has it or not, so we can kind of plan appropriately, long term. So the leukemia vaccine we can give, and we can prevent that disease and still test for it if we're ever suspicious. FIV used to be given to all outdoor cats, but it's kind of fallen out of favor. And the reason for that is the test that we have to diagnose FIV, so if a cat comes in and we're suspicious of it, the one test that we have will be positive if the cat has the disease or if they've had the vaccine. So we can't say definitively, if it's really the disease or if it's just because the cat was vaccinated previously.
If you test them for those 2 of those non-core and they have it, you can't cure it.
You can't cure it,
So
no.
you have to put the cat down?
Some people opt to euthanize the cat just because it's a serious condition, and they know that long term there's going to be lots of infections and things. And if there's lots of other cats in the household, they may be exposed to more things. If they planned on it being an outdoor cat, that's not a good lifestyle option for the cat. On the other hand, just with advances in medicine and everything, if it's the only cat in the house or all the other cats are vaccinated, these cats can often do very well long term if they're in the appropriate household and the owners are just very vigilant for any secondary infections that might be happening. We know that we see increased rates of cancer with those diseases as well, so that's something that kind of has to be on the radar if we know the cat has that and they get sick down the road. So going back to FIV, used to vaccinate for it with all outdoor cats. We don't so much anymore because we lose the ability to determine if a positive test result is a true positive or a false positive from the vaccine. That being said, some people will say, my cat's outdoor all the time. I see all these other cats roaming around the neighborhood. I'd rather he or she just have the protection on board. and that's fine too. We just have to know if we're ever suspicious for FIV that our test isn't going to be reliable. Any questions on the vaccines? All right.
Is that one with the 3 viruses, is that once a year?
That one, kind of. That's a good question. So the rhinotracheitis and the calicivirus portion of it are yearly, and then the panleukopenia portion is every 3 years. So like at our hospital, when you get your reminders, the name of the vaccine that we use is a PureVax, and there's 2 types, PureVax 3, which just has the first 2 components, and then a PureVax 4, which has all 3. So every 3rd year, your cat would get the PureVax 4. In the 2 years in between, it would just get the PureVax 3. Because we know from studies that have been done, we don't need to booster that panleukopenia portion every year. So why put extra stuff into their system if we know we can get the immunity we need with less frequent vaccination?
So if I have outdoor cats, you know me, I've got these crazy cats in mine. If I've got outdoor cats, what's the least I want to do? I want to do rabies.
Rabies, the FVRCP, and feline leukemia.
Okay, and if money is an issue and I really can't afford it, because how often do I have to do that one, that feline leukemia one?
That one is typically once a year if it's an outdoor cat.
I can't even catch them, let alone give them the vaccine. Okay, so if I have those, then I have to, the best if money's an issue and I'm not going to be able to catch them, I've got to go with the rabies and I've got to go with the feline, the first one up there, the core one.
Yeah. Mm-hmm.
Okay,
at least the 2 core. Being outside, we pretty much know that it would be exposed to leukemia, however. Mm-hmm. If you can catch them, like once or twice and at least get the initial booster series on board, at least they have some degree of protection. 7 years from now, it might not be ideal, if we can't get those regular boosters in, but at least there would be something there. So the benefits are pretty obvious. We're protecting, the cat from diseases. And these are diseases that we know are out there. Even though, we've been vaccinating for decades now, we still see cats that are unvaccinated come in with these diseases. And that's because they're in the environment, they're in the, feral stray cat population, and they get spread around that way and transmitted to our pet cats as well. And it's not just protecting your cats, it's kind of the herd mentality, it's protecting other people's cats as well. So the risks, and this is where people tend to get scared. I'll stress first that all of these are very rare. We hardly ever see any of these kind of downside things. I'll say it more than once during this presentation. A lot of what people believe about their animals is kind of reflective of what's happening in human medicine and human medical thoughts. So there's a lot of talk about autism and vaccines, even though those studies were found to be falsified, but that's still the thought out there. And so people are kind of adverse to vaccinating and that thing for some of those reasons. So you'll see that with diet and stuff too, but we'll talk more about that. The more common thing that we see, even though it's still rare, would be a vaccine reaction. And so that's where the cat's immune system responds inappropriately to something in the vaccine. And we, where I work, use adjuvant-free vaccines, so it doesn't have some of those odd chemicals and things in it. And so that tends to lessen the frequency of the reactions. But this would present like an anaphylactic reaction in a person, like with a bee sting. So swelling, difficulty breathing, hives, things like that, collapse. Usually it's on the second vaccine because the first time they get vaccinated, that was the first time they were exposed to anything. Their immune system kind of prepares to freak out the next time that it's exposed to whatever it doesn't like, and then they get the second vaccine and have the reaction. That is kind of an emergency situation, especially if there's difficulty breathing, vomiting, things like that. But it's pretty easily remedied with some short-acting steroids and an antihistamine that we can get through. And then we always, mark in the patient's record, they had a reaction to this vaccine, and so we just don't give that one in the future. And then we have to take that into consideration with the cat's lifestyle. So if we were planning on an indoor-outdoor cat and they reacted to the leukemia vaccine, then maybe we have to switch up our lifestyle goals for that pet. The other one reaction risk you might hear about is injection site sarcoma. Has anybody heard of that? Okay, so that's a type of cancer that we can see with injections in cats. And originally, it was attributed just to vaccines, but we know now through lots of retrospective studies that have been done looking at all the cats, that get these types of tumors, that it's any type of injection that a cat gets. So cats' connective tissue cells, which are called fibroblasts, they make scar tissue, collagen that holds, soft tissue together. They seem to be much more reactive than, dogs or people or other species. And so when they get an injection, sometimes, very rarely, like 1 in 30,000 cats, I think is the figure that's out there now, will develop a mass secondary to that injection from that stimulus. Like I said, it's not just a vaccine. It could be an antibiotic injection. It could be an injection of fluids under the skin to help with some dehydration, all of those types of things. So these masses, when they occur, they tend to look very small on the surface, but they kind of have these tentacles that spread deeper into the tissue. So they're very locally aggressive. They don't tend to spread, to the spleen, the lungs, the liver, that type of thing, but they're very locally aggressive. So what some of the studies have found doing some more advanced imaging like CT is that even though we might have a little lump like a centimeter over the shoulder, it could go, very deep into the muscles and be very invasive. So what the veterinary community has done to kind of get a leg up on this situation is we've changed where we give vaccines. So we used to give, kind of everything over the shoulders. Just if your cat was getting 4 vaccines, they just went 1, 2, 3, 4, across the shoulder blades. But if a cat gets a mass over the shoulders, surgically, we can't do much about that. If it's invading into all those muscles, we don't really have any options there. So what we've done now, even though this is rare, is we've started giving vaccinations over the elbows and over the knee. And it doesn't seem to be any more uncomfortable for the cat. I think they just sit there as normal as they would with any other injection. And this gives us the option, should one of those masses arise, we can at least amputate that limb because it's going to be locally invasive. So if it's invading down here around the elbow, we can remove up here, and we know there's not going to be any spread of the mass because they only spread locally, and we can still get rid of the entire mass. Versus if it was over the shoulder, we could debulk the mass, but we would never get all of it, and it would just come back.
I have a question. How old would you suggest the cat to be for its shots? Like you adopt a kitten that you don't, a stray or whatever, how old should we wait before we bring him in for their shots? How old should
Good question. 8 weeks.
8 weeks.
Yeah, we know by 8 weeks their maternal antibodies, so kind of the antibodies that they've gotten from their mother have gone away. If we give a vaccine before then, it kind of just like cancels each other out. And so we start at 8 weeks and we go like every 3 to 4 weeks. And the goal is to have, the rabies, like I said, is only a 1 vaccine situation. So then for the FVRCP, we want to have at least 2 of those after the cat is 12 weeks old. Okay? So if they get, 1 at 13 weeks and then 1 at 17 weeks, they're good to go until the next year. Okay, this will probably be the longest portion, so we can take a break after this. We'll talk about some common feline diseases. This isn't all-encompassing. I just tried to pick some of the most common things that I see and I think that people have questions about and kind of need to be educated about on what to look for some of these more serious conditions. So I tried to split it up to have like a little description of the disease, talk about the clinical signs, what you might notice at home, diagnostics, what your vet might recommend, and some treatment, what your vet might, say, hey, this is what we need to do. Little disclaimer, this is kind of generalizations. These diseases are really complex and can have a lot of secondary problems with them. So if I only have 2 things up there for diagnostics, don't hold me to that, because there's a lot of other things going on, or multiple diseases. And I think you'll see when we start going through some of these how very similar they appear at home until we start doing some tests and things to get us some answers. So we'll start with endocrine disorders first. And we'll start with diabetes. So diabetes in cats is very similar to human type 2 diabetes, like the diabetes from being overweight. And we tend to see it in overweight, middle-aged to older cats. And the problem is that in the overweight cat, the body basically decides that I have all this extra fat and sugar, and so I don't need insulin to start driving it into the cells to use for energy and all that sort of thing. So the pancreas slowly starts shutting down and stops making insulin, and that's where we run into trouble, because we still need insulin to get sugar into the cells to do their normal job. So things that you would notice at home can be an increased or a decreased appetite. So remember, the sugar isn't getting where it's supposed to be, so the body, the brain thinks that it's still hungry because it's not getting any energy, so it tells the cat to eat more, so we'll see that. If the disease goes on for a period of time, some toxins can start to build up in the body, ketones, and that can cause the appetite to decrease at that point. So it can kind of be one or the other depending on where they're at in the disease process. We can see weight loss because, again, they're eating, but none of that sugar is getting stored anywhere. And so they start to lose weight because none of it's really being used. And then probably the biggest thing is increased drinking and increased urinations. So when blood sugar gets high, it starts to spill out into the urine, and that pulls water with it. And so that causes increased water loss, and so the body says, hey, we're losing all this water, we got to drink some more, and so the cat drinks more. So you'll tend to see larger clumps of urine in the litter box, and then the cat will just be hanging out at the water bowl all the time, or sitting by the sink trying to get some extra water to stay hydrated, to kind of keep up with those losses that are happening through the kidneys. Diagnostics that would be recommended would be blood work. Blood glucose is kind of the big thing here, to see if the blood glucose is actually high, just like in people. The tricky thing with cats is that when they get stressed, their blood sugar also gets high. And so if a cat comes in and its blood sugar is way over, we can say, okay, that's probably from diabetes. But there's kind of a gray zone where sometimes it's like, well, that could be diabetes, or it could just be a really scared, stressed out cat. And so if that's the case, there's another blood test that we can do that we send off to the lab. And it gives us kind of a picture of the previous 2 to 3 weeks of if blood glucose has been consistently high, like with the diabetic cat, or if that number is low, then we know that the cat's just stressed and that's why its blood glucose is high. The other test that's commonly recommended to work up the diabetic cat is a urinalysis, and that's to show that there is sugar in the urine, that we're having that spillover effect, and to also look for those toxic molecules, the ketones, which can make them feel really crummy.
How do they get that urine out of a cat? I've gone with a dog.
So with a cat, typically we do what's called a cystocentesis, which is a fancy way of saying we use a needle and a syringe to go into the bladder through the abdominal wall. Now it sounds kind of scary, but one thing we do to make it safe is we use the ultrasound. And so we can put the ultrasound on the belly, and the bladder is right under the abdominal wall on a cat. And so we can see the bladder right there, and we can watch the needle actually go into the bladder. So we know that we're not, sticking anything that we should be. You can do it blind as well, just by palpating, but I always like to use the ultrasound just to know that I'm in the bladder. I'm not going, too deep or hitting anything that I shouldn't be hitting. And also, it gives me a visualization of the bladder. I can't see the bladder on my physical exam. The ultrasound lets me do that, so if I stumble across some stones or something, just using the ultrasound to get my sample is kind of another diagnostic in itself. The other thing we do to make it less stressful is that we go right on the midline of the cat. And on the midline, that's where all the abdominal muscles come together. So there's like a really thick, fibrous sheet there, and it doesn't have a lot of nerves. So if you go through there, it's not painful really for the cat, and the bladder outside doesn't have a lot of nerves to it, and so it's not really a painful thing. It's no more painful than a regular injection through the skin. So that's how we get that.
How do you, my cat weighs 11 pounds no matter what. And I give her a quarter cup in the morning and a quarter cup in the evening, and then when she starts hanging around the food bowl, then I'll give her a little more. And no matter what, she's 11 pounds.
Yeah, yeah.
And I try to increase the playing, you know.
Sure.
But 11 pounds, you know, no matter what.
Yeah. Have you ever tried any other diets?
Well, it's weight management. She loves chicken and rice, and that's it.
Okay.
But you mean another brand altogether?
Yeah, there are some prescription diets that are out now that are really designed to not decrease the amount of food so much so the cat still feels like it's full, but it increases the metabolism, which can burn off some of that extra fat. Hill's metabolic diet is one of the ones that we carry. I actually have my dog on that because he has some weight issues, and it's been very beneficial, and he was kind of the same way. You know, he always wanted to eat more, and so, you know, we tried decreasing the amount of food, but then he was driving us crazy. And so with this diet, he still gets a normal portion of food, but metabolically speaking, he can lose weight that way.
Okay.
So that might be something to think about. So treatment for diabetes is pretty similar to that in people as well because the disease is so similar. So insulin is one of our mainstays of treatment, and that's given via a syringe and needle at home. It's a very teeny tiny needle, and they honestly really don't even notice that they're getting an injection. The biggest kind of challenge with insulin therapy is just making sure they're, like in people, their blood sugar doesn't go too low. And so we want to make sure the cat's always eating before we give insulin and so on and so forth. And if you ever have a diabetic cat, your vet and the technicians typically have a nice long conversation about all of these things to watch for and whatnot. Diet change is another big part of things, both to help with weight loss and to also just have less fat and carbohydrates in the diet. So they tend to be like higher fiber diets. And then oral hypoglycemics, so those are like oral medications that lower the blood sugar. A lot of human pre-diabetics will kind of start out on those medications to try and stop full-blown diabetes from happening. We use those from time to time in cats. They're not as effective in cats. I think most studies say like 15 to 20% effective rate. I have had one cat since I've been practicing actually respond to it and revert and become a non-diabetic. So they do work from time to time. We used it in that patient because he was very aggressive and there was no way the owner could give an injection at home. And so with the diet and the oral hypoglycemics, we actually got him to go back to normal and become a non-diabetic. So they have a role, but it's certainly not like our go-to therapy for that disease. And this is your typical diabetic cat, kind of a couch potato. I tried to have some pictures throughout here to keep it entertaining. Some are funny, some are kind of gross, but. So the next endocrine disease is hyperthyroidism. This is another pretty common one that we see. And this is where the thyroid gland increases the production of thyroid hormone. Thyroid hormone normally plays a big role in metabolism in the body. So it helps, start break down food when you eat. It keeps you active, all that type of stuff. We know it also plays a role in the heart and the kidneys, which is kind of a big deal when we start doing some of our testing and when we're looking for things on physical exam. Typically, these cats either have a benign growth on the thyroid or the thyroid tissue is just overactive. It's usually not a cancerous process, even if there is a mass there. And typically, it's a very small mass. It's usually not something that we can even feel on our exam. But regardless of what it is, the thyroid is producing too much of that thyroid hormone, which causes the clinical signs that we see. And so increased appetite. So like I said, the thyroid is involved in metabolism and processing food. So these cats are ravenously hungry. They're like always wanting to eat. But despite eating all the time, they have a lot of weight loss. So they're very skinny. They're usually restless. The thyroid, keeps you alert, gets you going. So they're kind of anxious all the time. They might be like pacing around the house, seem kind of like twitchy. We see vomiting with it, increased drinking and urinations because of some of the effects that the hormone has on the kidneys. And those are just the common things. There's probably another like 20 signs that we can see on our exam, like heart murmurs, arrhythmias, all sorts of things. But those are the most common things that people say, this is what my cat's doing at home. So for diagnostics, the blood test is called a serum T4, and that's just measuring the amount of thyroid hormone in the blood. That basically gives us our answer right there. Most vet hospitals do that in-house. So it's kind of a quick rule in or rule out if that disease is going on. And because that hormone affects so many other body systems, we often recommend other blood work at that time to make sure the kidneys are doing okay, make sure the liver is doing okay, because we can see some changes in those enzymes as well with hyperthyroidism. If we suspect heart disease, we'll oftentimes recommend radiographs to look at the heart, see if it's really big, is there anything we need to do there? And sometimes urine analysis to make sure to rule out other disease processes that look very similar. I mean, just in the two diseases we've looked so far, increased appetite, weight loss, drinking and urination changes are similar between the two. And that's only two diseases so far, so like I said, a lot of them look similar. The other reason that blood work is beneficial is if we start treatment, the main treatment can change some of the blood cell numbers, and so we want to have a baseline to know where they're at, so we can check it after starting treatment and make sure everything stays happy that way. So the treatment is anti-thyroid medications. It basically just slows down the function of the thyroid gland. That's the most common means of treatment. There is a new prescription diet out there called YD from Hills, and there's been some success with that, just switching diet. It has lower iodine content. The thyroid gland uses a lot of iodine to pump out that hormone. And then those methods, the first two, typically kind of are treating the problem. They don't really cure it. This last one, radioactive iodine treatment, basically uses an injection of radioactive iodine, and that all goes right to the thyroid gland and just destroys a good portion of that tissue. And so that kind of solves the problem right there. The downside is it's more expensive, but the benefit is that it's just kind of a one and done situation, and you're not giving pills every day, and so on and so forth. This is your typical cat with hyperthyroidism. You can see he's really scrawny, kind of unkempt looking. The eyes are wide, looks alert, and he's probably eating all the time. So moving on to gastrointestinal disorders, I think I have the most in this category because they're probably the most common. And the big take home here is they all look pretty much identical. So we'll start with inflammatory bowel disease. This is similar to Crohn's disease in people. And basically, for one reason or another, we're not sure exactly why or how it happens, but there's inflammation in the gastrointestinal tract. And that can be the stomach, the small intestine, the colon, or multiple portions of it. Some people suggest that diet plays a role, so we often try some diet change early on, but there's a lot of other factors that we just really don't understand as far as like the immune system, playing a role with this disease and that type of thing. So like I said, there's inflammation throughout the GI tract, and that causes the clinical signs that we see: vomiting, diarrhea, anorexia or inappetence, weight loss, and all of this can be waxing and waning. So typically people with this disease, people will come in and say, yeah, my cat, last month he was throwing up and didn't want to eat. But like now he's fine. And then they come in the next year, yeah, you know, about every like 3 months, he's got some loose stool, kind of goes off food, but then he's fine. That's kind of the classic picture for these cats. And that's because there's an increase in inflammation in the gut. The cat doesn't do well for, you know, a little bit, and then that inflammation slowly dies down and the cat goes back to being normal. We can certainly see it where it's a more aggressive situation where that inflammation persists and they're just, like my mom's cat has it. He would vomit like once every day. And so like that was just his thing. So there's always some low grade inflammation in the GI tract. Diagnosis for this is kind of tricky. The only way to truly diagnose it is with a biopsy. And no matter how you slice it, that's either invasive or expensive. So we can do incisional biopsies where we go in through an abdominal incision and take out, you know, full thickness portions of the GI tract. That gives us the most information because we have all the layers, but it's the most invasive. That's a surgery to get an answer, plus sending that off to the lab. The other way we can get biopsy is with an endoscope, which is the little camera that we can put down their throat and go into their stomach. The benefit with that is it's much less invasive, much quicker recovery time because we're not really doing much. The disadvantage is with the little tweezers that we use, we can only get a few of the layers of the intestinal tract, and sometimes that inflammation is a little deeper, and we can only reach so far with that camera. So typically we only get the stomach and the first part of the small intestine. That leaves a lot of tissue that we can't sample. The other way we can kind of diagnose it is to basically rule everything else out. So make sure there's not inflammation in the pancreas or the liver or that type of thing, and that's what's kind of left over. Oftentimes we can do like a treatment trial, and if they respond to that long term, that also can kind of confirm it for us. So treatment is usually steroids tapered to a very low dose to get them through kind of an acute flare-up. It's kind of a normal anti-inflammatory dose. And then we can sometimes get it down to a steroid dose like once or twice a week even, and that's enough to kind of keep the inflammation at bay. Diet change, you know, if there is like a protein instigating component expected, sometimes diet change will be enough and they won't need any medications. And then supplementation with some vitamins. We know that like their vitamin B12 and folate levels can get low with this disease. So sometimes some injections of that long term, once we get them healed up, can get them feeling better and deal with some secondary problems.
Do you at your business, do you have cat vitamins?
We have like the injectable version of the vitamin B12, and then we sell some supplements kind of in our reception area as well.
Okay. Mm-hmm. I haven't been able to find cat vitamins anywhere.
Yeah, if you're looking for like a multivitamin, I don't know if we carry anything like that, but you can certainly find it like probably PetSmart or Petco maybe, or online. I'm not as familiar with like all of those products, but you can do research and find out, you know, what's good out there. With these guys, it's typically an injection of a vitamin because we do it like once a week, and that kind of stays in their system and then slowly fades out. So this is a picture of an endoscopic image of a cat with inflammatory bowel disease. So you can see like this normal pink tissue here. I know it's kind of blurry, but then see how red and irritated all of that is. So that's kind of what we're looking for when we do those endoscopic examinations. I'm going to start speeding up a little bit to get through this other stuff because we got about an hour left and a lot to do. So alimentary or gastrointestinal lymphoma, everything about it is identical to inflammatory bowel disease, which we just talked about. The clinical signs, the diagnostics, the only thing that's different is the treatment involves some chemotherapy because it's a type of cancer. However, you basically have to go through those more invasive diagnostics to get an answer because a different treatment is needed. So that's where it differs a little bit. But they'll tend to still have some of the same vitamin deficiencies. The clinical signs are all pretty much the same. Sometimes if people opt to do like a steroid trial to see if it's the inflammatory bowel disease, If a cat has the GI lymphoma, it will improve as well, but then these cats tend to become refractory to the steroids. So whereas the inflammatory bowel disease cat would continue to do well on a low dose of steroids, the cat with lymphoma would eventually, the clinical signs would come back because those cancerous cells just kind of override the medication. Pancreatitis, we hear about that a lot in dogs. I think, the dog gets into the garbage can, gets a fatty meal, the pancreas reacts, becomes inflamed, and they get very, very sick from it. Cats can have a similar acute presentation to that, but more common is what we call a chronic active pancreatitis. And so that just means that there's kind of low-grade inflammation long-term. And so these cats aren't horribly sick, but might just be, have an off appetite from time to time, be a little lethargic, and kind of long-term. Again, very similar to the other two diseases that we just talked about, anorexia, lethargy, maybe some vomiting here and there, diarrhea. Very occasionally they'll have a painful abdomen if it's the more acute form. But the big thing here is that because there's this low-grade inflammation long-term, aside from that causing them to be sick, we can see diabetes develop secondary to this, and other types of pancreatic dysfunction like exocrine pancreatic insufficiency develop because of that chronic inflammation. It's just slowly breaking down the pancreas. So it's a bad disease in itself, but it can cause other diseases on top of it. So diagnostics for that is a blood test called a SPEC FPL, and that looks at a specific enzyme made by the pancreas, and we have studies that have come up with guidelines. If it's above this, it's associated with pancreatitis, and that's pretty sensitive for diagnosing. And then in conjunction with that, we always like to do an abdominal ultrasound so we can actually look at the pancreas, see if there's inflammation or edema, swelling, that type of thing there. Those two things together are used to diagnose this disease. Treatment for it, it depends on kind of the severity. If it's, one of those acute cases, we do, aggressive fluid therapy and things like that. But it typically involves like some pain meds, a diet change to a lower fat diet or more easy to digest diet. Some fluids, like I said. We know that with this disease, the pancreas has a lot of fluid coming into it, drawing fluid from elsewhere, so we want to keep the animal hydrated. Antiemetics, which are anti-vomiting or anti-nausea medications. These cats are anorexic because they don't feel good, they're nauseous, so if we can get rid of that feeling, we can get them eating again, get nutrients back into the GI tract, and get them healing up. Prednisone is our steroid, plays a role sometimes in long-term management because we know it's a low-grade inflammation. So similar to the inflammatory bowel disease, we can start them on that medication and kind of taper it down to a lowest effective dose that keeps that inflammation low-key and not causing problems or those secondary diseases that we talked about. And sometimes with cats, antibiotics will play a role in this disease. Just with their anatomy, there's kind of a more direct route from the GI tract where there's bacteria to the pancreas. So sometimes those bacteria will kind of sneak up into the pancreas and cause some problems that way. It's not very common, but it does happen. Next disease is cholangiohepatitis, which is inflammation of the biliary tree, so like the gallbladder and its little draining vessels and kind of the liver surrounding that. This is another one of those conditions we don't always know what causes it. It's kind of, again, a low-grade inflammation. Are you catching a pattern here with cats and GI disease? And it can have, dietary causes, immune-mediated causes. We're not really sure all the time. Clinical signs, wait for it, big surprise here. Anorexia, lethargy, vomiting, sometimes diarrhea, abdominal pain. Again, all the same things we've been seeing. The one thing different here is sometimes we'll see icterus or jaundice, where the skin and mucous membranes and things become yellow, and I have a picture of that to show you. Diagnosis is some blood work to see if the liver values are elevated. There's some certain patterns that we look for with those different liver enzymes that kind of point towards this versus other types of liver disease. Ultrasound gives us a good look at the liver. Is there actually inflammation there? Is the gallbladder inflamed? Is the wall thickened? that type of thing. Biopsy is needed to confirm, but typically whenever there's liver disease, we get a little standoffish about going in and doing a surgical procedure to get a biopsy that way. So oftentimes, with the blood work and the ultrasound, we get enough information to be, pretty strongly suspicious of this, coupled with the clinical signs to kind of diagnose it and then go forward with treatment. Treatment is some antibiotics. Again, because of that anatomy, we know the bacteria can get up to the liver just like they can get up to the pancreas. Prednisone, again, to kind of keep the inflammation down. Sometimes that's a long-term, lowest effective dose situation. Liver protective medications, and these are kind of more like supplements. They basically provide some molecules that the liver uses frequently. And so the liver doesn't have to synthesize it itself. It can just use the ones that we're supplementing, so it makes the liver's job easier, basically. Helps reduce some inflammation from like oxidation and things like that. There's some other liver protective medications that help bring water into the gallbladder to kind of loosen up some of the sludge that's in there and get things flowing through a little bit better. Diet changes, diets that have, like less protein so the liver doesn't have to process as much, are more easy to digest to help with some of that inflammation. And then we usually supplement these guys with vitamins. It's vitamin K especially because we know that the liver makes that, and so if the liver's not working, we can run into some clotting problems from vitamin K being low. And then kind of like with the other things we've talked about, that vitamin B12 often goes low. So this cholangiohepatitis, pancreatitis, and inflammatory bowel disease, we can actually see happening all at the same time. We call it triaditis for the three things happening. So whenever a cat has one of those things, we always have to be suspicious that the other things are going on too. On the plus side, I think you can appreciate that the treatment is very similar for all three. And so typically, if we diagnose cholangiohepatitis, but there's some mild inflammatory bowel disease going on, but we didn't do the scope to really look at the GI tract, our treatment is going to kind of hit both disease processes for us. Last one here for the gastrointestinal is hepatic lipidosis or fatty liver syndrome. This really isn't a primary disease in itself, but it happens secondary to other disease processes. This can happen any time that a cat stops eating, and this is a kind of a unique thing to the cat. It happens, in all species to some degree, but it happens very significantly in the cat. And so what happens is the cat stops eating, so it's not taking in energy. So the body says, I've got to do something if I want to keep working, right? So it starts breaking down fat to use as energy, which is a fine thing to do, but the liver is kind of the rate limiting step here. It can only process so much fat at a time. So the fat comes into the liver, it's being processed, the liver starts to get overwhelmed, and so it stores the fat within the liver, so it's kind of right there and ready to use when it does get caught up. But that starts causing the liver cells to swell, which blocks off those bile duct vessels and other things and causes irritation. And so it kind of basically shuts down the liver. So it's a biggest concern in an overweight cat that stops eating because they have more fat to mobilize, and so the liver can get overwhelmed the fastest. So the clinical sign you'll see with that is icterus, jaundice, when a cat has stopped eating. So this is some pictures of the icterus. So you can see on this image over here, see how the ear is yellow? The skin of the ear is yellow. If you look around the eyelid margins, they're yellow as well. And then it's a little more subtle here, but his nose is yellow too. On this one, they're lifting up the lip, and you can see that the lip and the gums are yellow. And then you can see his nose is yellow too. Another thing we'll see is the whites of the eyes will become yellow. If it's like a short-haired cat and they don't have a lot of hair on their belly, their belly skin might be yellow. So yellowness anywhere, always a big concern, especially in a cat that's not eating. I have one more. Dental disease, this is super common. I see this in like 95% of the cats that I see. Way more common than any of the other things we talked about, even though these are all common things. So it's just like in people. There's plaque, gets turned into tartar. That builds up, leads to gingivitis, which is inflammation of the gums. and eventually we can get from that periodontal disease where the infection gets deeper into the tooth, in the root, and some of the ligaments and stuff that hold it in place. This, like I said, it's very common, it's easy to treat, and it can cause a lot of discomfort to the cat. So it's something to be aware of. So signs you might notice at home, and typically this is more when there's severe disease, is like difficulty eating, drooling, a foul odor from the mouth, a discharge from the mouth. Those are kind of more severe signs. I'll show you some pictures of what more mild disease looks like, but it can still be painful. If there's, one of the signs of inflammation is pain, whether it's in the joint, the pancreas, the mouth. If there's inflammation, there is pain. They just go hand in hand. So if there's gingivitis, that's painful.
My cat, I really worry about her teeth, and I use the enzymatic toothpaste.
Perfect.
And I can't get a toothbrush in or anything, but if I pull this up taut,
Kind of like that picture?
If I turn her on her back and just pull this up, I can, if I'm really fast, I can get, I'm worried about these upper two up here.
And in the back?
Yeah.
The big teeth?
Yeah.
Yeah.
And I can get them, but if I get my finger in the way, it's the stars.
Yeah.
But I can never get down here.
On the bottom?
Never ever. And I can't, of course, get inside the teeth.
Right.
But I guess the enzymatic toothpaste just goes all over.
Right, it kind of gets everywhere.
Okay.
And then the way that the mouth of the dog and the cat is designed is that the way that the forces kind of shear everything is that everything kind of gets pushed up to those upper teeth. So if you look at pretty much any animal with, mild to moderate dental disease, it tends to all be on the upper teeth. Because those lower teeth, it just tends to get sheared off better. The tongue's there, it can kind of work some stuff away.
Like a skin that comes up, and it's just in the way. I can't get around it.
It makes it difficult.
Yeah.
And so brushing is the cheapest and most effective thing you can do. So kudos for doing that. But it is difficult, especially in a cat. Like it's one thing in a dog, but a cat mouth is much smaller and much sharper.
Let me ask you one more thing. I give her a pet kiss, and it's got 4 natural things in it, and I can't remember anything except beet extract right now. And I give her 3 teaspoons, or 3 teaspoons, 1 tablespoon per quarter gallon of water, and the manufacturer says to make it bottled water because tap water breaks it down.
Yeah.
And it doesn't have an odor to it, and I've tasted it. It doesn't taste like anything, but I notice every once in a while she'll start drinking, and she goes like, "What in the world is that?" And I don't know if it'll do her any harm or not as time goes on to have that all the time.
Yeah.
Do you think that must
I'm not familiar with that one. I know of some other water additives that are safe to use long term, so I'm guessing it's a similar type of thing, and it is okay to use it long term. She might be picking up on something, that she tastes or smells that we just can't, they have a stronger sense of smell and things like that.
And then the feline prescriptions.
The diet?
Yeah. She won't touch them. Says cats love the flavor, but she hates it.
Yeah. So she's talking about a special food, TD, is that the one? Yeah. And so it's designed, it's a larger kibble, so it kind of forces the cat to chew and crunch and scrape the tartar off the teeth. And then it's also designed to let the tooth sink in a little bit, so it kind of scrapes the sides of the tooth before it crumbles, versus a regular piece of kibble that as soon as they squish down a little bit, it just cracks. So brushing the teeth is good, the water additives are good, the TD food is good. You can feed that as the sole diet, or a lot of people just use it as a treat, give 5 to 8 pieces throughout the day. And so it's a little kind of mini brushing throughout the day. And then There are some oral sprays that you can use too, that like the toothpaste kind of mix with the saliva to help break down some of the tartar. And I think a lot of cat people tend to like that versus trying to get a toothbrush in there. If you can brush the teeth, that's awesome. But that just doesn't happen with every cat. So the sprays can be a nice option too. So diagnosis for dental disease is pretty straightforward. Physical exam, and sometimes we'll recommend x-rays of the teeth, just like we get when we go to the dentist, if there seems to be some deeper infection, so we can assess the roots a little bit better. Treatment is a dental cleaning, may or may not include extractions depending on how significant the disease is. And with your question, we were able to talk about the prevention, so I don't think I need to say anything else about that. So this is kind of more moderate disease, I would say. If you look at this tooth down here, this is a perfect example of what you were talking about. So down here, this is nice and pink like it should be. There's maybe a little discoloration to this tooth here, but nothing too exciting. If we go up here though, you can see all this brown stuff caked on the tooth. That's tartar. And then see how red and inflamed the gum is? That's gingivitis, okay? If we let that go, we know that this is painful and needs to be dealt with as soon as possible right away. But if we let something like this go, this is what it will progress to. And so you can see in this picture, the gingivitis is much more severe. It's all over the place. And can you appreciate how the gums have started to recede down? And you can start to see some of the roots of the tooth now. Like up here. Does everybody see that? And so that's because that infection with the gingivitis has started to work its way up under the gums and has started to kind of push it up and expose the roots. So those teeth in this case would most likely come out. The previous ones, once we got the tartar and things off of there, that gingivitis would go away and that would kind of be it.
I'll take a quick break.
Yeah, we can.